Hello, and welcome to our webinar on the Quality Payment Program Year 5, 2021 eligibility. We're so glad that you've joined us today. As a reminder, the information contained in this presentation is for general information purposes only, and it is up to date and correct as of today. For those of you not familiar with the vast array of services that we provide at the Kentucky Regional Extension Center, we have provided them here. The Kentucky REC is an outreach arm of UK Healthcare, and we partner with healthcare organizations across the state to provide guidance around a host of regulatory programs and quality improvement initiatives. My name is Laura Wright, and I'm joined by my colleagues Kelly Fountain and Brent Doom, who will be providing the content for us today. We've got a lot of great information lined up for you. We'll start by level setting and providing a brief review of the MIPS program essentials. Excuse me. Then we'll discuss MIPS eligibility, followed by APM eligibility. We will help you understand how CMS determines eligibility and how you can find out if you are in fact deemed eligible. Finally, as always, we will take your questions at the end, and I will now hand things over to Brent to kick us off.
All right, thank you so much, Laura. So to kick us off here, we're going to go through some Year 5 program essentials for the Quality Payment Program. So as we know, the Quality Payment Program, for those of you that are newer in this, it has been around for a few years, and there are two tracks associated with the Quality Payment Program. On one side, we have the merit-based incentive payment system that based on your performance within this track, you are subject to a payment adjustment. We'll talk about those payment adjustments and how they impact later in today's presentation. But the other track that's associated with the Quality Payment Program is the alternative payment model, so the APM track. And through this track, as an APM entity, you assume the risk that's associated with the care that the quality of care that you deliver to your patients and the cost of care that is associated with the care that they receive. So by assessing and assuming this risk as an APM entity, you subject yourself to a 5% lump sum payment. So if you perform at a high level, you can receive that 5% lump sum payment. Moving on through the MIPS overview, we're going to focus on MIPS in a large portion as far as it ties to the eligibility for today's presentation. I do want to call out that while we are in Year 5 of the Quality Payment Program, this is the 2021 program year, and this is going to be associated, that payment adjustment based on your performance for this year is going to be seen reflected in the 2023 payment year. So as we move across the slide, I do want to call your attention to the category weights. This year, quality is at 40%, promoting interoperability and improvement activities are at 25% and 15% respectively, and then cost is at 20%. We continue to see quality and cost stair-step to even out. So quality is slowly stair-stepping down and cost is slowly stair-stepping up to even out. We do know that as the program does progress through its years, that quality and cost will ultimately even out at 30% apiece. As far as reporting timeframes are considered, quality and cost are at a standard 365 days. And then the promoting interoperability and improvement activities categories are at a minimum 90 consecutive days required for those two categories. Go ahead and circle it on your calendars. March 31st of 2022. It seems like it's a long way off, but I think we all know that it'll be here before we know it. This is the anticipated deadline based on historical years that the attestation screens for the Quality Payment Program in the QPP portal will close. So that'll be the attestation deadline for our current program year. In talking about that 9% adjustment factor, so 9% is at risk. And when you think about your bottom line, 9% is a substantial amount. I want to call your attention to our minimum performance threshold. So our minimum performance threshold is 60 points for Year 5. And so this is the threshold that you have to meet in order to avoid penalty. Anywhere below 60 points, so in that 0 to 59 point range, you're looking at a sliding scale from 0 points to that -9 points going down. So more closely to that 59, 60 point range, you're looking at a lower payment, a lower negative payment adjustment. But at that 0 point mark, if you don't submit anything when you should have, when you were supposed to, you're going to be looking at receiving that full negative 9% payment adjustment. Now, as we move up in those point thresholds, we look at the 61 to 64 points. And so this is what we call the potential positive payment adjustment range. The reason we call it potential and not guaranteed is because due to the way that the program is structured, it being budget neutral, those that are receiving negative payment adjustments are funding those that are basically receiving those positive payment adjustments. So depending on how those numbers fall, those that benefit from those positive payment adjustments and those that receive those negative payment adjustments, depending on how that falls, depends on how much money there is in that pool for those that positive payment adjustments. Above 85 points, this is going to be our exceptional performance threshold. And so this threshold is set currently at 85 points. And this is where you're guaranteed to receive a positive payment adjustment. So now going through a few of those reporting options for year 5 really hasn't changed a whole lot as the program has progressed, but we have our first reporting option is at the individual level. So this is where an NPI and tax ID combo is under a single individual eligible clinician. At the group level, this is where 2 or more clinicians come together underneath a single tax ID, and they come together to report. You can also report as a group, as an APM entity. And then our third option here that we want to highlight is our virtual group reporting option. So this is a combination of at least 2 tax IDs that are assigned to at least one individual MIPS eligible clinician, or a virtual group may also be a combination of 2 10s assigned to at least one group consisting of no more than 10 eligible clinicians with at least one MIPS eligible clinician. So those are a few reporting options that we want to highlight for you all today. There's some advantages and disadvantages with each one as it pertains to the payment adjustments and audit purposes, and really just the overall alignment with going through the program. As far as the categories are concerned, we do have just some simple basics that we want to run through. So for the quality category, we have our 6 required measures. One of those has to be, at least one of those has to be an outcome measure. So looking at patient outcomes. Now, there is an alternative reporting method for some of the larger organizations that participate in the program called CMS Web Interface. And just so everybody knows, this will be the final year for CMS Web Interface, as CMS is sunsetting it after the 2021 program year. Also with the quality category, we have 2 claims-based population health measures associated that you will be evaluated on. Moving along to cost, this category is totally based on your Medicare claims. So there are a total of 20 measures, 18 of those are episode-based measures, and then we have our Medicare spending per beneficiary measure 1, and then we have measure 2, total per capita cost. And so this is based entirely on your Medicare Part B claims. Improvement activities, this category requires you to obtain 40 points raw score in order to get full credit in the category. You achieve these 40 points by a combination of medium and highly weighted activities. One caveat with this category is that 50% of your eligible clinicians must participate in the same activity. While they must complete the same activity, this does not necessarily mean that they have to complete the activity in the same 90 days. So if you have a few different timeframes, depending on how many eligible clinicians it takes to meet that 50% mark, say you have 10 total eligible clinicians, 5 of them have to do that activity, maybe 2 of them do it in 190 days, and then the other 3 do it and complete it in another 90 days. One way in which you can receive full credit for the category is by having 50% of your locations under a single tax ID certified and having received that recognition that's associated with PCMH, or patient-centered medical home, or PCSP, which is patient-centered specialty practice. So if you have those, at least 50% of your locations having received that recognition, then you can automatically get full credit for the category. With promoting interoperability, again, raw points is what we're looking at here. So at least 100 raw points are required for a full score in this category. So we have 4 objectives. Scoring is predominantly based on performance score and bonus. And then we have this category requires you to have a 2015 certified EHR. When it comes to looking at collection of data and submitting the data, so really looking at how we progress throughout the year and submitting this data to CMS, we'll look at quality first. So as I mentioned, you have to have 6 required measures that you have to attest for. And so hopefully back in January or back earlier this year, you went through those processes as an organization or as a clinician to figure out what measures you wanted to focus on for this year. So you go through, you select your measures. Now, as you move throughout the year, you want to begin to collect your data and look at monthly data or quarterly data, or however often you look at those snapshots to figure out how can we improve, how can we maximize our performance. And then ultimately, at the end of it all, you will look to submit your data to CMS. Improvement activities has some similar workflows. So of course, there's the selection of your improvement activities because there are a whole host of them. And so you find one that really fits your organization and fits the niche that you're going for, or really just how to improve your clinical practice. So once you've selected that, you map out your timeframes and everything like that. So you get all the planning going through. And then as you're going through those 90 days, you'll take your screenshots or you'll get your supporting documentation to have on the back end. And of course, you'll submit your data as well to CMS for that category, or you'll submit and attest for those improvement activities. Promoting interoperability. This is going to be very standard. So there's no selection for your measures. Those measures are predetermined. So you're going to begin collecting and monitoring very similar to the quality process on a monthly or quarterly basis, trying to figure out what are some interventions, how can we drive improvement to maximize our performance. And then ultimately, of course, you'll go ahead and submit that information and data to CMS during attestation season. And then cost category, there's of course no submission required on your behalf because you're continuously submitting your Part B claims throughout the calendar year. So that's one load off your mind as far as actual collection and submission. That one's kind of taking care of itself. As far as submission types, these are just kind of blanketed bullet points, but we do have a direct option. So this is direct to CMS via an API. Logging in and uploading, logging in and attesting. This is through the QPP portal. And so largely with the login and upload, you'll log in and upload the file. So a QRDA3, for instance, for quality, or with logging in and attesting, you would log in and manually attest for, say, your improvement activity. Just selecting your activity, giving your timeframes and entering in that information. As I mentioned, web interface is for our larger practices for quality. And then Part B claims, you can submit for if you're a smaller practice for quality or of course for cost. At the submitter type, we have our individuals, we have our groups, and then we also have our third-party intermediary designations. And that third-party intermediary is going to be looking at QCDRs or registries if you utilize one of those methods. In digging further into eligibility, we're going to start looking at what are the eligibility requirements for each track. We're going to focus largely on the MIPS eligible clinician determination factors and the steps that CMS goes through in determining eligibility. So the first step that CMS goes through, if you look here at the circles, it's this gray circle here. They're going to look to see if you are a MIPS eligible clinician type. And so at the bottom of the slide here, we have our eligible clinician types listed out. You can be a physician of any of those 6 designations. You could be a PT, an OT, an audiologist, a registered dietitian, or a nutrition professional. There's a whole host of eligible clinician types. So if you meet one of those, then CMS checks that box and they move on to the next step. The next step is to look and see if you exceed the low volume threshold. And so for the MIPS track, the low volume thresholds are those that you see under where it says merit-based incentive program, or MIPS, as the 90,000 Part B billing, the 200 Medicare patients, and the 200 professional covered services. And so you have to exceed each of those three. You have to exceed all three of those low volume thresholds in order to be eligible in the program, fully eligible. And so once CMS defines and verifies that you exceed all three of those low volume thresholds, then they check that box and move you on to the next step, being that they will verify whether or not you are a qualifying participant or a QP within an APM. In order to be a MIPS eligible clinician, you will not be able to be a QP in an APM. So they're just wanting to verify to make sure that you do not fall under that designation. And then the last step that CMS verifies is to make sure that you are enrolled as a Medicare provider before calendar year 2021. If you became enrolled as a Medicare provider in early 2021, chances are you probably won't be eligible for the program this year, but it will be good to know looking ahead as to what kind of eligibility you will have in coming years. I also want to highlight what the advanced alternative payment model eligibility requirements are. So you first have to be an advanced APM participant, and you either have to have 50% of your payments running through that APM, or you have to have 35% of your Medicare patients attributed to that APM. So just a brief overview of some of those steps that CMS goes through. Now, to determine those timeframes in which CMS does utilize to determine your eligibility, they do a 2-segment determination period for the MIPS track. And so we've already completed segment 1. Segment 1 for the MIPS track ran from October 1st, 2019 through September 30th of 2020. And so that's the initial eligibility that we're working with right now. So if you log into the QPP portal, look at the participation status tool, you'll see that eligibility that was determined in that first segment, and that was released in December of 2020. We're currently in the second segment, so running from October 1st of 2020 to September 30th of 2021, and we anticipate that final eligibility being released somewhere around November or more towards the end of the year. CMS simply uses this data to, of course, determine your eligibility within the program, to assign any special statuses, and to update clinician lists for practices to make sure that everything is all good and everything stays up to date. Talking about some of those special statuses that you may receive and be designated under, we do have first our small practices. So these are our practices that have 15 or fewer clinicians billing under the practice. We also have non-patient facing. So this is if a clinician has 100 or fewer Part B patient facing encounters during those determination periods that we just talked about. If you're designated as a health professional shortage area, this is of course a clinician or practice that's designated under that Public Health Service Act. Rural practices are practices in zip codes designated as rural using the most recent HRSA data file. Then we have hospital-based, so clinicians that furnish at least 75% of their covered professional services in an inpatient hospital, or any of those that are designated based on those places service codes. And then lastly, we have our ambulatory surgical center. So this is where a clinician furnishes at least 75% or more of his or her professional services in sites that are identified with that place of service code 24. And so the question you might be asking is, how do I know if I've been designated as having received one of these special statuses? So at a group or individual level, this special status will be shown and added to your eligibility profile within the QPP participation status tool. So you'll just be able to go on into that tool and look up to see if you've received one of those special statuses. As far as APM and virtual group entities, you'll have to sign into your qpp.cms.gov profile or into the portal to view any of those special statuses. And then small group is the only special status that's available to APM. So I will just highlight that. Now, we've talked a lot about being fully eligible within the MIPS track or within the program. And I want to let you all know of another way in which you can become eligible within the program. And this is if you are Optin eligible. Now, at the bottom right-hand side of the slide, you can see what this looks like if you're looking at it within the QPP portal or within that participation status lookup. So it's not showing that you're eligible at the individual level, but you are at the group level. So you don't exceed the low volume thresholds as an individual, but as a group with the collective effort, you are exceeding. So this is what they're calling and deeming an opt-in eligible clinician. So you are opt-in eligible as an individual. And so being opt-in means that you alone are exceeding one or two, but not all three of these low volume thresholds. So whether it's the billing and the patients, but not the services, or maybe it's the patients and the services, but not the billing, whatever that combination may look and feel for each of you is kind of how they determine that opt-in eligibility. We want to make this known to you all because if you can benefit from the program, then it could be a good opportunity for you to take advantage of. However, if you may not feel confident, or maybe you feel that 9% is a lot at risk, and maybe it's just more of a risk than you want to chance by opting in, then that's a choice that you can make too. So you're not required to participate in the program. This is generally for those that want to be able to reap the benefits associated with a higher payment, positive payment adjustment. The one good thing about this is that it is not a proactive decision. So you don't have to decide in, say, January 1 of the performance year. It's later on in the year that you can make this decision and decide that, hey, I've done, my performance is really good. And I think we need to maybe move forward with this to see where we fall. So that's just something that is on the table and up for grabs for individuals that fall into that category. Lastly, here we want to talk about our APM determination period. So the APM side follows a little bit of a different pattern in comparison to the MIPS track. So they go through 4 snapshots, 3 snapshots for really just the true APMs, and then the 4th snapshot is for our MIPS APM. So kind of that gray area, if you will, between MIPS and the APM track. So it's kind of like a mid-step. But our first snapshot will cover the first 3 months of the year, and we can expect that to be released sometime midsummer, so around July. Snapshot 2 will cover those first 6 months, coming out in the fall, and then snapshot 3 for APMs will come out, or will cover year to date through August 31st, and will be released later in December. And then that 4th snapshot for those MIPS APMs will cover a full calendar year and will be released in March of 2022. Of course, this data is used very similarly to the MIPS determination period data in determining what that status is and to update that APM participation for each APM entity. I will now be turning it over to my colleague, Kelly Fountain, and she will walk us through the rest of the presentation.
All right, thank you, Brent. So first we're going to start off with where do you go to validate or verify if you're eligible for the quality payment program. Of course, this is kind of one of our common or most popular websites we often tell you about, and that's qpp.cms.gov. So that's going to be the first place that you're going to go. And you need a few key pieces of information to really kind of check to see if you're eligible for this program. First, you're going to need an NPI, or that National Provider Identifier. This is going to be unique to the clinician or clinicians in your practice, and you're going to want all of their NPIs if possible so that you can type them in to check their eligibility. And what CMS is going to do is it's going to check to confirm that that provider is an eligible clinician type, bills at least $90,000 in Medicare Part B, 200 Medicare patients, and 200 or more covered services. Essentially, if you meet or exceed one or more of those, you're going to see something kind of pop up as an opt-in eligible, which is what Brent was talking about, or if you're eligible at the group, individual, or both. So we can go ahead and go on to the next slide, and we're going to look at kind of what it looks like when you type in a provider. Now, we have kind of just taken dummy screenshots to show you here. The first thing you're going to see when you land on the landing screen for qpp.cms.gov is that there's a place for you to type in the NPI number. To the right of that, you're going to see check status. Once you click that button that says check status, you're going to have it populate over to the right. This clinician is associated with 2 separate practices. And this is important because CMS recognizes the NPI-10 combo as a unique entity. So it is possible for the same clinician to be eligible or have eligibility under 2 or more practices. For practice number 1, you'll see that this clinician is eligible not only at the individual level, but also at the group level. For practice 2, they're only available or eligible at the group level. So under practice 1, this clinician must submit data in order to avoid penalty for the quality payment program because they are eligible at the group and individual level. Group means that you just can opt in to participate. Individual means that you must participate in order to avoid the penalty. So moving on, we'll kind of take a look at a couple additional screenshots throughout the process. So here you'll see if you were to scroll down on the screen. First, you'll see the clinician level information, and we'll kind of walk through those elements first. And then you'll go into other reporting factors, and then finally that practice level detail. So first, we'll see that the clinician level, yes, they did exceed the low volume threshold. They exceeded 200 covered patients. And they had over $90,000 in Medicare Part B, and of course, over 200 covered services for this clinician. They are an eligible clinician, and they were enrolled after or before January 1st of 2021. So they've met that criteria. Now, other reporting factors, you'll see that they're non-patient facing and they're a small practice. These are special statuses that impact their eligibility or their reporting requirements. In addition to that, you'll see at the practice level, they are defined as small, which does mean that it increases the weight associated with improvement activities and provides additional flexibility, such as under promoting interoperability. Now, at the practice level details, you'll see that overall the practice exceeded the low volume threshold, which of course is the number of patients, charges, and covered services under the tax ID. So moving on, we'll kind of dig a little bit further into this. So when you log into the QPP system, this is going to require you to have a HARP account. So login and password. And this is required if you're going to get your performance feedback, if you are going to attest to the quality payment program. This is really critical to have at least 1, if not 2, security officials and or end users for a practice in order to ensure that everything is accurate in the system and you're able to meet the requirements for the program. Now, for this instance, we're actually using my account, which is just a dummy account. So you'll see it says, "Welcome back, Kelly Fountain." At the top of the screen, you'll see kind of a general timeline. So January 4th of 2021 is when the submission window for 2020 program year opened. It did run, of course, all the way through March 31st of 2021. So that was the last day that you could submit for 2020's performance. April 1st is when you received your first preliminary performance feedback. And then sometime in summer, you should receive your final performance feedback as appropriate or available. Now, I will say typically this happens in July, but we normally see 1 to 2 renditions depending on the exceptions process in any of those targeted reviews. In addition, on the screen on the left-hand side, you'll see eligibility and reporting, you'll see performance feedback, APM incentive, payments, exception applications, targeted reviews, reports, manage access, and help and support. And then below that, you'll see kind of the preliminary feedback that's available, and then it'll also tell you your submission window has closed for 2020. Depending on when you log into the system, it's going to change a little bit on this landing screen as kind of what is appropriate at that given time. So if you were wanting to check eligibility and you had already checked it at the main landing site, but you really wanted more details, this is where we would recommend that you go. So you're going to navigate to, on the left-hand side, the eligibility and reporting. So we'll go ahead and move on to the next screenshot that'll show that. So once you click on that, you're going to land here, and it's going to show you the eligibility status for performance year 2020. Now you'll see there's a little chevron that says performance year 2020, and a little arrow down, caret down. If you click on that, you can actually navigate to 21. For the purposes of today's kind of webinar, We've just stuck with the 2020 and we're navigating through the screens. So again, we're going to click a little bit further here. So we're going to go on to the next screen. And here you'll see, once you click the little chevron to expand, that practice 1 and practice 2. So under this dummy system, I have access to 2 different practices. Practice 1 is MIPS eligible and practice 2 is MIPS eligible as well. And they exceed low volume threshold. Now, what's a little bit different between this view and the view that you see on the main landing when you check participation is that you're going to see numbers associated with these practices. There's no numbers associated with mine because it's not really associated with any actual practices. But you would see, yes, they would exceed low volume threshold, the number of patients attributed to that practice, the number of charges, the number of covered services, and any special statuses or APM participation associated with those practices. You could then also click on the little button that says View Clinician Eligibility, and that's going to give you a list of every clinician that's tied to that practice, remembering that the NPI-10 combo is really seen as a unique entity according to CMS. So if we move on to the next slide, we'll see here the practice details for the clinicians. So this is once you click on that View Clinician Details. You'll see the first practice or first clinician here. You'll see that it's MIPS eligible and that there was an extreme and uncontrollable circumstance applied for this dummy practice. Next, we can kind of go down to the next screen. And here is where you're going to have clinician 1 and clinician 2. Again, these are just dummy folks. So MIPS eligibility, you're going to see the individual is grayed out. That means that this clinician is not required to submit at the individual level. However, they are eligible to submit at the group level. In addition to that, you'll see some kind of exceptions that were applied for the clinician as well. And that clinician 2 looks very similar as well. You'll also see if the reporting period you're looking at is opened or closed, or if it's open for targeted review. Oftentimes you'll see little flags in the system, and that'll tell you kind of what is going on currently with the system, where you are within that timeline or that flow. Okay, moving on. So we'll go ahead and look at a couple different elements. So I've hit on it a few times throughout this piece, and I know that Brent has as well. Now, if you're eligible at the individual level, so when you log into the QPP system, if you have your HARP credentials and you want to check the eligible clinicians associated with your practice, you're going to see individual and group level eligibility. If you are eligible at the individual level, you must submit to the quality payment program in order to avoid penalty. However, if you're eligible only at the group level, then you have the option to submit, in which case, if you submit, you will qualify for whatever group level assessment happens and that associated positive or negative payment adjustment with that performance. Now, individual level versus group, there are pros and cons. If you are both eligible at the group and the individual level, you do have the option to submit both ways. You can submit at the individual level, and then you can also contribute to the group level reporting as well. Now, what's going to happen is CMS is going to essentially assess your performance under both the group and the individual. Whichever one is going to render you the highest score is the one that ultimately CMS will apply to you. Now, for larger entities, group level submission is typically what we see. It's easier, there's less administrative burden. Remembering that everything that you submit to CMS, you do have to back up and maintain documentation for at least 6 years. So larger entities, 10 or more clinicians, we typically see group level submission. However, on occasion, we have seen folks that want to attest about group and individual, especially for some of their providers that really have a special patient population they're really working on. So it's a diabetes patient population, and they want to submit specific measures that perhaps are not applicable to the group. They can do so. CMS will evaluate. The downside to doing individual versus group, if you are in a larger practice, is that your individual payment adjustment might differ from clinician to clinician, which sometimes can make it a little bit difficult to track, but it's not unbearable by any means. All right, so we can go ahead and move on to the next slide. So thinking about kind of the timeline of things, we are currently in program year 2021. And program year 2021 began January 1st of this year, and it will run all the way through December 31st. We are currently also awaiting the notice for proposed rulemaking for the 2022 program year, and sometimes they make changes to the current program year. That NPRM is expected sometime in the summer, and typically we see a final rule released sometime in the fall, sometimes late fall. And of course, that does impact the following program year. Brent touched base on a couple of the best times to check your eligibility. The very first snapshot is actually already available. CMS pulls it the previous year, and that's your kind of baseline snapshot. Then, of course, there are 3 snapshots that take place throughout the course of the year. I'll always recommend the final and the binding one is in December. So sometime November through December is when you're going to see your final standing of eligibility for that program year quality payment program. In addition to that, we'll see mid-year, the feedback report will be released, and that's going to be for the prior year's performance. Not only going to tell you how you scored across cost, quality, improvement activities, and promoting interoperability, it's going to assess you and provide you a final score. And that final score is going to be associated with a payment adjustment. And of course, that payment adjustment is going to go into effect 2 years after the fact. So when we get 2020's feedback report in the summer of 2021, we know that that's going to impact payments on Medicare Part B beginning January 1st of 2022. So it's kind of always a 2-year rolling. Really, ultimately, you want to make sure that you check and verify early in the system eligibility associations with your tax ID. We know that you have providers join and leave, so you want to make sure that PAYCOS is up to date so that that does roll over into the QPP system. Now is a perfect time to gain access to the QPP system if you do not have a security official. It is crucial for evaluating your feedback report as well as attesting for the program. Now, once you get that feedback report, it's important to review it immediately if possible, so that if something is wrong, you can submit for a targeted review. You do have a short time frame to do so, and ultimately, once that time frame has extended, there's no recourse for making any changes to your performance. So we have covered a whole lot of information today. Ultimately, we want you to know that this is a cycle. We're always ending the previous year while we're in the middle of collecting data for the current year, and we're planning or thinking about what the future is going to bring. We're in the final year of this transitional MIPS, and so next year there are a lot of things that are up in the air that could change. So you want to make sure to stay ahead of everything as much as possible. Make sure you take this year to really clean up your PAYCOS and have a down pat system in place if possible. All right, we'll go ahead and go on to the next slide. All right, I'm going to hand it over to Laura and she's going to wrap us up.
Thank you so much, Brent and Kelly. You all provided a ton of information, and I think you've provided us with anything and everything we could ever need to know around eligibility. So we wanted to just take a minute, in case you don't already partner with us, to talk a little bit about how we can help you here at the Kentucky REC. Our team of expert advisors are here to help you not only understand all of the moving targets associated with the quality payment program, but also to help you analyze your systems, the data generated from those systems, and how your practice can move from your baseline towards your goals. We know that participating in the quality payment program is just one small part of your day-to-day lives, which is why we break the program, education, and action plan down into bite-sized pieces, so that throughout the year, we are slowly working towards meeting and exceeding your goals. Here at the Kentucky REC, we strive to be your trusted advisor and strategic partner, and we hope you will partner with us to keep improving healthcare across Kentucky. Another advantage of working with an advisor at the Kentucky REC, if you'll go to the next slide, is the access you'll have to our resources, including our client-only webinars, tip sheets. We can also assist with attestation prep and support, as well as audit support in case you are unfortunately required to submit an audit to CMS. Now, if you have not already done so, we'd like to ask you to go ahead and enter any questions you have in the Q&A box. And as you're doing that, I'm just going to go over a few additional pieces of information. First is our upcoming webinars. So we have a couple coming up, one in May and one in June, where we are going to be talking about applying data validation techniques to first the cost category and then the promoting interoperability category. I want to point out that these are client-only webinars. So if this is something you'd be interested in and you're not a client, please reach out so that we can see what we can do to work with you and get you signed up. And then in July, Kelly put a really good plug in there for our webinar that we're going to be hosting all around your feedback reports and doing some of that mid-year planning. And this webinar is open to all. We also wanted to take a minute to touch on the Medicaid promoting interoperability support that we offer free of charge to providers that are eligible to participate. This is grant funding service to help you prepare for participating in the Promoting Interoperability program and to help you attest for that program. As a reminder, this is the last year of the program and the deadline to attest is quickly approaching. It is August 31st of this year. So if you think you're eligible and would like to participate, please reach out so we can help you get this last year of incentive money. Also, a security risk assessment is a piece of many different regulatory programs. So we just wanted to briefly mention that we have a few different services available related to your SRA, and including vulnerability scanning, as well as a new virtual SRA. And then we also offer telehealth services for organizations that are interested in starting a telehealth program or would like to ensure their program is sustainable past the public health emergency. If we can help you in any way, please reach out to us and we are always happy to help you. So now I'm going to check our Q&A and see what questions we can answer for you all. So it looks like the first one we have is around the improvement activities performance category, and it's concerning the bit about the PCMH and PCSP. So the question is, do 50% of clinics have to be PCMH, PCSP certified to be eligible for 100% approval for the IA performance category?
So I'll go ahead and jump on and take that. So I believe, if I understood and heard the question correctly, the answer is yes. So you have to have 50% of your locations associated with that tax ID having received that recognition for that PCMH or PCSP designation. So yes, 50% to receive full credit for the improvement activities category.
All right, thank you. Now, I heard Brent mention that web interface is going away. So how will quality be submitted for practices that participate in an ACO going forward?
All right, Laura, I can take that one. So yes, web interface is going away. Originally, it was set to sunset actually prior to 2021 program year. However, in the last final rule and comment period, CMS heard all of the feedback from everyone that's participating and ultimately said that they would give one more year for kind of making adjustments. So if you are using web interface, whether you are an ACO or if you're a large practice with 25 or more clinicians, this is your final year that you can use that as a method for collection and submission. For ACOs in the future, as well as large practices, the encouragement is really to look at clinical QCDRs, at qualified clinical data registries, or some type of registry that allows for aggregation of data. CMS says that it is the responsibility of the participants to aggregate the data. They will not do so on a practice or a ACO entity's behalf. So this is really the final year to kind of work out those kinks. Now, the good news is that CMS did shorten the core measure set associated with ACO participation. So we're really only looking at a handful of measures that are required moving forward beyond 2021.
All right, thank you, Kelly. So regarding the promoting interoperability category, do you have to conduct an SRA or that security risk assessment for this category?
So I'll take that one. Yes, the answer to that is yes. You do have to complete an SRA each program year for the MIPS track, and really for several regulatory programs in those tracks. So for promoting interoperability in MIPS specifically, it is really just a hard stop. So if you do not have that SRA completion, unfortunately, you would receive a 0 for the PI performance category. And so it's really just that hard stop. So the answer is yes, you do have to go ahead and knock those SRAs out. And you can call us if you need one.
All right, thanks, Brent. Looks like we have one more, and I know this gets a little bit confusing. So the question is, on the QPP site, all of my clinicians are Optin eligible at the individual clinician level, but our practice is eligible to report at the group level. So are we required to report at the group level?
Laura, I can take that question. So if ultimately it comes down to individuals being required to submit. So if you're eligible at the individual level, not opt-in eligible, but fully eligible, then you have to participate in the program to avoid the penalty. However, if you're eligible at the group level, that means that if the group decides to attest, they can. And what's going to happen is the clinicians associated with that group would qualify for the positive or negative payment adjustments. However, if you're opt-in eligible, that just means just that. You have the option to evaluate your performance and make the decision to either opt in to participate or use the flexibility provided to you because you haven't met the low volume threshold to set out and not have to participate in the program.
All right, thank you. It looks like that's all the questions we have for today. I want to thank Kelly and Brent one more time for providing us with all of this great information. And again, please reach out if there's anything we can help you with. Have a great day. Thanks.